Welcome to Wellness Wednesday. Thank you for joining us for another episode. I'm Paige Reynolds, your host for tonight, along with Carla Coleman, Director of Communications here at New Salem. This evening, we are blessed to have Dr. Heather Bowen. She will be speaking with us about our eye health. Remember to put your questions in the chat throughout the presentation and we'll get them answered. So, Dr. Bowen, as I kick this off to you, can you tell us a little bit about yourself?
Sure will. Hi, everyone. I'm Dr. Heather Bowen-Jones, but I go by Dr. Bowen. I came to New Salem in 2007. However, I'm originally from Quincy, Illinois, which is about 6 hours southwest of Chicago. I went to undergrad at Illinois State University and have a dual degree in chemistry and biochemistry, molecular biology. And then I have a doctorate from Ohio State and from 2011. So I've been with New Salem since 2007, which I loved. I can't believe it's already 14 years. and so I'm just going to be here talking about general eye health, when people should get eye exams, and the importance of having a yearly eye exam.
Sounds great. Let's get started.
All righty.
I will share my screen.
Perfect. All right, everyone. So we're just going to start with some general landmarks of the eye. So the first part of the eye, the outside structures, the cornea, that's the part that we see with. We travel a little bit further into the eye. We'll have the pupil, which everyone knows is just the black part of the eye. Then we'll have the lens. That's where cataracts can occur. And then we head further back to the back part of the eye, to the retina. That's the part that captures light, that helps us see, and then it transfers all the information to the nerve. The nerve is actually the extension of the brain that helps us see and how we process all the information. So this is actually a picture of someone's eye. So the back part of the eye, you'll see all these blood vessels, their arteries and veins. You'll also see the optic nerve again. That's the front part of the eye. And then there's a marking called the fovea. That's your central vision. That's your straight ahead vision. That is where all the information initially goes to before it goes into the optic nerve. So we'll be talking about different structures along the way, all of which can have problems that can interfere with people seeing clearly. So to get started, I recommend everyone should have a yearly eye exam. And what does that include? An eye exam includes checking for eye alignment, overall eye health, and then making sure that you have that dilation so we can look into the back part of people's eyes. When we go back to the actual eye, there's 4 muscles that control all of the eye movement. The head and neck area is very important to make sure that is healthy as well, because that can help determine if there's any eye issues that we have or need to address. So for children per se, I always recommend the first eye exam for children to be anywhere between 6 and 12 months. I know that sounds early for a lot of people, but the earlier, the better. So at 6 and 12 months, we can actually check to see if they actually need to wear glasses. There's a program called the Infant C program that quite a few doctors participate with. I currently do not, but there's Nationwide Children's Hospital, the College of Optometry, and some other practices around town that will see children as young as 6 months all the way up to a year. And that's a program funded through the state. That's a free eye exam for any children from 6 to 12 months. If there's no problems in that area, then we recommend yearly eye exams starting at the age of 3 to make sure that we are not missing anything. Children don't know what clear vision is, and so if we can catch it earlier and address it, it will be better for the overall health. I forgot to mention that I currently practice at 2 different offices. One is called Divine Family Eye Care with Dr. Sylvia Jones, and I have been there 9 years with her. at Divine Family Eye Care. I also practice 2 days a week for a surgeon's office called Northwest Eye Surgeons, and I've been there for about 6 years. Each have their own like type of modalities and stuff like that. But going back to after a child's 3 years old, then we decide, is it important to do yearly versus every other year for some people? As you grow, your eyesight can change. So we hear it all the time of people saying, "Oh, I don't need glasses." Well, you might not need glasses, but we need to make sure that we see you for overall eye health. Anything I need to add right now?
Oh, do we have any questions?
No, no questions in the chat. Remember to put your questions there. But Dr. Bowen, are there, even though we should be seen regularly, are there certain signs that come along that we're like, you need to go be checked and seen?
Yes. So if your vision feels like it's blurry, if the eyes itch, if they feel heavy, I know a lot of people are spending a lot of time on digital media right now. So I'm hearing a lot about fatigue. Fatigue is just really the eyes are feeling heavy and they're unable to focus. Well, it could be that somebody needs glasses, or it could be that we're working with the issue of dryness. And dryness affects about 40 million people a year. We're seeing a lot more of it just because of the digital aspects of all this at home working and learning and stuff like that. So, but yeah, those are common issues why people should come and see us on a regular basis.
Yeah, one of the questions. Sure. Oh, go ahead.
You got it. No, you got it.
No, I was going to say, one of the questions in the chat was how best to manage that eye fatigue. What should we do?
Oh, that's a great question. So if you're going to spend, let's say, an hour on your digital media, you want to make sure you're at a proper viewing distance. It's not too close, it's not too far, but about once an hour, you want to take 20 seconds and either stare at the distance or close your eyes. That will help rejuvenate those tears and relax all those muscles that you're using to being able to see. So I like to tell people, if you're going to be on there for an hour, you need to take it anywhere between 20 seconds and a minute and not look at anything. Either stare off to the distance or close your eyes, just to give your eyes a rest to help with that fatigue. And then it will help you study and learn a lot longer.
Mm-hmm. Yeah, we don't do that too often.
No. As for adults, I love seeing adults. I did a residency at the Columbus and Chillicothe VAs more in disease management. So I love seeing adults. I'm not a big fan of seeing children. I do it, but I love just seeing adults. Dr. Jones at the practice loves seeing children. So we have a good balance there. But as for adults, if you don't think you need glasses, please still come see us or see someone. I always get the question, what's the difference between ophthalmology and optometry? Ophthalmology are medical doctors that do more of the surgery, the LASIK, the glaucoma surgery, the cataract surgery. So they do a little bit more of advanced disease medicine on the surgical side. Optometrists do the best job at the refractive management and initial disease management. So we can take care of a whole lot of things that ophthalmology can do. However, if it's more advanced and we need a surgical intervention, we will send you off to one of them. So in a basic eye exam, we look for eye alignment, making sure that both eyes are focusing straight ahead. We look to make sure that you can fix and follow. We look to make sure that your pupils are reacting. Then we also check the prescription. That's the part where everybody loves. What's better, one or two that when you go through an exam. And then the most important part is dilation. So we can look at the back part of the eye. It really helps open up the eye so we can make sure that there's no disease processes occurring in the back part of the eye. And why I say that is because most disease processes that happen in the eye never hurt. So when people do come in and see us, sometimes it's minor, but sometimes it can be advanced because it never hurts on the inside of the eye.
Yeah, there was one question that was, what do you do when you get older and begin to see spots in your eye?
Well, that can be tricky. Spots can occur because of eye dryness. Spots can occur because your blood pressure could be elevated, and that can cause spots in your vision. Spots can occur if it's unfortunate, if you have what we call a retinal detachment. So that second slide that Miss Page showed us, the back part where the blood vessels are laying, that can actually get holes and tears. The next one. Yes. So the orange part that you're seeing, that part can get holes and tears, and that can cause spots in your vision. But again, that won't hurt. So we have to be able to look in and determine where the spots are coming from.
Great. Paige.
Yes. So each time you go to the eye doctor, do you have to be dilated?
No, you do not. People come in for different reasons. So if it's something on the cornea, which is that first layer of the eye that I was talking about, we probably wouldn't dilate you. Initial exam, if we've never seen you, we would dilate you. And there's also sometimes that people just don't want to be dilated. So we then go ahead and take a picture, just like the picture that I have shown you, just to make sure that there's nothing going on back there.
Mm-hmm. Okay. Are there supplements you can take to aid in eye health?
The only supplement that we really recommend, and it's only for people who have what we call macular degeneration, is the eye vitamins that you've probably seen the commercials for through like Bausch and Lomb or Ocuvite, or it's called AREDS, AREDS. But the best thing for people's eyes is omega-3s, and you can get that through eating fish or taking the supplement, and then lots of green leafy vegetables, just because they have a broader spectrum of zeaxanthin and lutein. Everybody loves carrots, but they're not high ranking as the green leafy vegetables. So eat more of those, okay?
It just seems like the discussion always comes back to the leafy vegetables. In certain supplements. I find that interesting.
But the supplements really for the eyes are really for people that have had the diagnosis of macular degeneration. Besides that, water, omega-3s, and lots of green leafy vegetables, and wearing sunglasses is the best thing you can do to protect your eye health.
Oh, that's a good excuse to get a new pair of sunglasses.
Yes, yes. Because it really helps decrease that UV exposure, especially UVB, that can do some damage to the eyes.
Great.
So with that, are contacts good over time, or should glasses be worn in place of them?
Contacts are great. I fit a lot of people in contacts, but worn properly, they're great. Worn improperly, they're a nightmare, because of the fact that they can people forget they're considered a medical device. And so if you dispose of them correctly, use the solutions correctly, no problem. The issue over time is when people don't wear them properly. They sleep in them when they're not supposed to. They reuse the cleaning solution instead of choosing new solution every day, using new solution every day, over wearing their contacts. Sometimes people wear them for 16, 17 hours a day. Usually you should only wear contacts for up to 12 hours a day, and then make sure that you're wearing them as prescribed. Because there's different ones. Like there's some people, like I wear daily. So when I put it in, at the end of the day, I throw it out. There's some other people that have 2-week contacts. So you want to make sure you can wear them every single day for 2 weeks, but at the end of the 2 weeks, you want to make sure you throw them out. Or there's monthly ones. There is a brand out there that's specifically for sleeping. So if you want to wear the sleeping contacts, you want to make sure that you're in that brand.
Yeah, I was going to ask the different types of contacts. Is one necessarily better than the other, or are they all good for whatever you want to use them for?
They are all great for whatever you want to use them for. The big three manufacturers are Alcon, Bausch and Lomb, and Johnson and Johnson. And so they all make, oh, and there's actually four people, different types of lenses for every type of eye. I could possibly there. We always try to start with soft contact lenses, but I still do fit a lot of people in hard contact lenses still. And so it just depends on your eye type and your eye health and your eye structure on which contact that we choose is the best for you. And there are some people who come in that want contacts and can't touch their own eye. And I was like, well, that's operation one. You have to be able to touch your own eye to be able to put these contacts in. and if you can't get past that, then we can't get contacts in you.
So what is the difference between hard and soft?
An actual hard one is more specific. We actually have to send that off and get made for someone's eye, whereas soft, they're more readily available and they're made of silicone or hydrogel, and they have they're more permeable and more readily available.
So we had a question, what is the best way to monitor eye health in general?
Really an exam based on what your doctor recommends. And then if you're ever on like any medications or anything like that, you want to make sure that you tell your eye doctor, because what people don't realize is a lot of medications have side effects that can affect the eye. So the best way is just to make sure that you're coming in once a year, once every other year, so we can check it out for you.
Yeah, for sure. So we had a more specific question.
Mhm.
How important is it to get anti-glare, transition lenses, blue lenses, or is it just a hustle to get you to pay more money?
I love anti-glare. All my glasses will have anti-glare. So basically, anti-glare reduces overhead light and light coming off of your screen. So so the eye doesn't have to work on trying to get rid of that extra light source. Blue lenses, that's something that's really relatively new. Basically, the mechanism behind that is it cuts down the yellow light coming off of the lenses, is to help reduce your eye having to work harder. In my case, I have about 50% of my patients can't tell the difference between having blue filter versus the anti-glare. It's really what you do. The most difference that I have seen are gamers. Gamers always tell me, oh, that blue filter works the best for me because they're playing the video games the most. But general population can't tell the difference. Transitions are patient specific. They have gotten better over the past 3 years. There's been a lot of an investment into them. So they transition faster. There's also some that actually look like there's a tint permanently on the glasses, and then they get even darker than normal transitions. So they have gotten better. And then again, it's whatever the patient really wants, whatever you really want to pay for. But I love sunglasses. Everybody should have one good pair of sunglasses.
I agree.
For sure. So for people who have gone and gotten their test done and they don't need glasses, they don't need contacts, would you recommend, if they do have a problem with that blue light, buying like third party or off Amazon from Target, the blue light glasses? Do those work just as good as from the doctor's office?
They do. I don't. When they have them from like Amazon or something like that, I don't know the actual material that they're made out of. But when they come from our offices, we can get the specific from the lab and stuff like that, and how they've been tested and stuff for the actual eye. But I have recently had more people bringing in are buying those types of glasses because of all the time people are spending at home in front of their computer and stuff like that.
So for someone specifically nearsighted, she asked how often she should get an eye exam.
Well, that's a great question, but I would want to know how nearsighted she is, because there's different degrees of nearsightedness. Somebody who's very high, I would say, let's throw out a number like a -8, always once a year. Somebody who's a -1 or 2, we could probably skip a year or something like that, just because we're looking for different structurally changes of the eye when somebody's high versus when somebody's low for nearsightedness.
Okay. So what is your view on polarized versus non-polarized sunglasses?
Oh, polarized actually do get darker. And basically, when you wear polarized lenses, especially when we can go back to go into the beaches and stuff like that, it actually helps you see better if you're going to be on water and helps reduce a lot more glare coming off of water. Right now, polarized sunglasses will work best for driving because it will help reduce the glare coming off the snow as well. But in general, if you're just going to be walking around and out, a normal pair of sunglasses, everything comes in, even if you buy them online on Amazon or anything, with UVA and UVB protection. And that's what we're really looking for, is that UVA, UVB type of protection, so we can really protect those eye structures so they don't get damaged from the sunlight. But if you're someone who spends lots of time on the water, thing like that, you want to make sure that you do polarized lenses.
Great. Nice.
Yeah, Carly, do you have any questions on your side?
Yeah, actually I do. When I turned 40, it was almost like to the day, like a week after my birthday, I went from 2025 to like this, you need glasses. So, and I've talked to a lot of my friends and colleagues, and that seems to happen a lot. Can you talk a little bit about that?
Yes, you went through what I call you've had enough birthdays, okay? But the technical term is called presbyopia, okay? It's the iris part of your eye that doesn't bend and flex anymore. And in your particular case, you are probably talking about, I had great vision, far away and up close, and I woke up and all my up close vision was gone. It disappeared overnight. I have to start tromboning, meaning moving everything. Good lighting always helps. I can't read the menus anymore. And so it happens to everybody about the age of 40 to 45. You'll start to notice that the eye doesn't see well anymore. And that's why when you go to Target or Walmart or Kroger's, you see that big tower. It has like the +1, the +2, those reading glasses, just because it happens to everybody. Nobody's going to get around presbyopia. So it's just one of those normal aging things that brings people into the doctors faster than anything. I can't see. It's over. No, you just need to start wearing reading glasses. Okay. So at that point, that age group that you were in, Miss Carla, is the number one reason that people come in, is their up close vision is completely eliminated. Yeah. Gone. So at that point, that's when we see a lot of people. That's when we want to assess where you're at in presbyopia. Are you at the beginning, the middle, or the end? It does level off after about the age of 47 to 50 for some people. It will level off. And at that point, we can see if with those changes that are occurring up close, well, does that affect your distance vision at all at that point? But keep in mind that there's certain groups of people, certain personalities are more resistant to wearing glasses than others. So I do have a lot of people at the age of 40 like, I'm ready for those contacts now. And I'm like, huh? Okay, here we go. So yes, it's very common. And it's just the inability to focus up close anymore with your natural eye. So we use readers or we use no line progressives, or we use a line bifocal to help you enhance that reading that most people need after the age of 40.
Great. That helps a lot. I just needed some understanding of that.
Yeah. So another reason why I do see a lot of people is because of diabetes. Diabetes is probably the number one reason why African Americans lose their sight.
Yeah.
And so, Paige, can you pull up the second slide of the eye? So we have these blood vessels, and the eye, once we get you dilated, nope, you were on the right one. So you see all those blood vessels, those are arteries and veins towards the back part, in the back part of your eye. So when we get you dilated, it's pretty much the only part of the body that we can look at your arteries and veins and figure out what's going on, with actually not having to cut into the body or use some form of ultrasound back there. And if those blood vessels start to leak with diabetes, it never hurts. And those blood vessels, if leaking into that fovea area, that central part of your area, can cause you to lose vision. And so if we see that in the eye, we then send you to a retinal specialist, and then they do some pretty advanced stuff, as if doing injections into the eye to get your eye not to bleed. And another thing they'll do is they'll start to laser those blood vessels. So think of it as cauterization into the back part of the eye. So they'll start to cauterize and shoot lasers back there to see if they can get a lot of leaking to stop. The unfortunate part, once they start to do the injections or any type of laser, at that point, they're trying to save whatever vision that you have. You might not regain a whole lot of vision. And so that's why when people are a diabetic, those are the people that we require to come back and see us once a year. Even if we don't give you new glasses every year, we want to see you just to make sure those blood vessels aren't changing. But also, we as a doctor, we want to make sure that you are properly managing your diabetes, and making sure you know that number of your A1C. That A1C helps us to gauge how well or how tightly that you're controlling your diabetes. And that can also be related to what we see in the back part of the eye. So somebody that has an A1C of like 7 or below, but are diabetic, we might not see any changes. But if someone has an A1C of 8 or 9, we could see changes in the back part of the eye. And if, like I said, if they start to get close to that fovea, that straight ahead vision, that's an automatic referral to the specialist.
Gotcha.
Mm-hmm.
Yeah. So what about when you talk about your blood sugar and managing that appropriately, blood pressure as well is an issue, is it not?
It can be, yes. So those blood vessels can actually show us not only diabetes, but it can show us if there are issues with blood pressure as well. It looks very different in the eye, but it can show us if your blood pressure is up, if you have cholesterol. So different anemias can show up in the eye as well. So even if people don't per se need glasses, but have, let's say, rheumatoid arthritis, and they're on methotrexate or hydroxychloroquine, some people might know it as Plaquenil, those have eye side effects that we would want to see you for to make sure that we're properly managing those diseases. People who have sickle cell, that's big in our community. We want to make sure we're seeing them as well, because sickle cell can have eye implications as well.
Excellent. It's good to know. Any other questions? That's all I have for right now. Paige, you have anything?
Yeah, I have a couple. So tracking back to reading glasses, should we wear reading glasses, or is it better to get a prescription?
Oh, no. It really depends on the patient. There are some patients that I really prescribe only reading glasses. Keep in mind, when you put reading glasses on, they are for reading. So they're not for to see far away. If you can put reading glasses on and see far away in them, you probably need to come in and get a prescription from us. But reading glasses don't do your eyes any harm. They literally are just making the image that you're looking at bigger. And so your eyes don't have to work as hard. But reading glasses are harmless if that's what we decide would be the best management for your particular vision.
Okay, got it. And then can you address sunglasses for babies and the old wives' tale of it messing up their color perception? Is that true or false?
No, that is false. Color perception is an inherited trait. And so it's usually people who are color deficient or have color vision problems are little boys. And more often than not, and it's usually a red-green type of color deficiency if you have true color deficiency or color blindness. We just don't see it that much in little girls or in girls in general. We mostly see it in boys, and it comes through on their mother's side.
Gotcha.
Okay, that's great to know. So now regarding makeup in the eyes, we all love to wear eyeliner and mascara, and I'm sure lashes. Could you give us your take on that?
Yes, please don't wear makeup to your exam. It's awful. They're run, everything like that. And please don't wear lashes that you want me to be very careful around them. Nope, 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 nope. I hate when people wear lashes just because they sometimes will fall off with the drops and stuff like that. If you like to wear makeup, do not wear waterproof makeup. It stays on your lids and lashes. It can cause you to get your oil glands inflamed or clogged. The regular makeup is actually the best. Soap and water, I like to use gentle ivory soap or baby shampoo, really to make sure we clean off our lids and lashes. Makeup remover is fine, but you want to make sure that you're using some that doesn't have like a lot of oil, so you don't get a whole bunch of residue from that. I wear makeup and stuff like that, but you always want to make sure that you're taking it off at night to reduce any type of infection. And if you are a contact lens wearer, please put your contacts in first, then put your makeup on to reduce getting makeup into the eye. If you do lashes, please don't use super glue. Please use eye glue. I do have people come in, their lids are stuck shut from super glue. It's the quickest way that we're going to cut off those lashes, and we're going to have to try to gently massage it in. So you came in wearing fake lashes, you're going to leave with no lashes. So, but yeah, so it's just all about making sure that if you do lashes, that it's a clean, they're healthy, and that if they use the approved glue, that's for them.
Okay. So if you were to get something in your eye, say makeup or like an eyelash, how would you recommend getting it out? With your finger, a Q-tip? What is the safest way?
Make sure that you can get it out. You can use most likely your finger can do it, but make sure your hands are clean. I would wash my hands first before you would. If you have some eye drops, some basic artificial tears, you maybe want to start flushing it out. Even some water. If you do get that in there, I would be careful with any other types of things like Visine, get the red out or anything like that, because that could mask the problem and stuff in that particular case.
Okay. So now we have another question. Can you talk about eye redness? What could be contributing to frequent eye redness? The person doesn't have diabetes, but it runs in their family. Eyes have been checked, but redness still seems to be a problem.
Oh, okay. Well, diabetes doesn't cause a whole lot of eye redness. Eye redness can come from dry eye. Eye redness can come from overuse of contact lenses. It could be general allergies. There are people who have like Crohn's disease, ulcerative colitis, and if they're having a flare up in their stomach region or anything like that, they could get eye redness as well. So pink eye redness is just a description of the eye. We want to get to the base part of the eye, and usually is red type of inflammation.
Uh-oh. See if we can get her back. 1 second, everyone. She should be back shortly.
Yes, and internet on his side.
Okay.
There she is.
There she is. We lost you there for a second.
Oh, I'm sorry.
Yeah. Just repeat what you just said.
Oh, okay. What part did I get cut off?
Just like the last sentence, I think.
Oh,
was the part
okay.
that cut out.
Oh, so I was saying that eye redness or pink eye are mostly a description, and we want to get to the root of why your eyes are pink or red. And so and sometimes it could be the overuse of contact lenses, or sometimes people overuse Visine, and that can make the eyes stay persistently red and stuff like that. Dryness is always a big issue. Or we just want to make sure we're getting to the root problem besides masking it with any type of eye drop. So Visine, Clear Eyes, get the red out and stuff like that. But definitely diabetes doesn't cause a whole lot of redness until the end stage. So it wouldn't be something at the very beginning.
Mm-hmm. What is dry eye? Can you explain that? And what are some of the symptoms?
Dry eye is actually the eye can water too much, or doesn't make enough tears by itself. So it's a disease process that causes the eyes to be uncomfortable. So basically sometimes people have to blink a lot, and you hear like, oh, I blink a lot just so I can make my images clear. That's a sign of dryness. People are saying my eyes water all the time is a sign of actually having dry, just because your lacrimal gland is just making more and more tears to keep your eyes moist. There is a disease called Sjogren's, where your body just doesn't make enough tears by itself. And so you can have dry eye from that. So it just makes the cornea, which is that first layer that I was talking about, very uncomfortable. And if that gets dry, it helps decrease the vision. So you don't have good vision and stuff like that.
Mm-hmm. Thanks. Back to you, Paige.
Yeah. Okay, we have another question. A friend of mine has MS and suffers from optic neuritis.
Oh, neuritis?
Neuritis.
Mm-hmm.
And has visual problems like blurred vision, double vision, etc. She asked me if I had heard of a way to deal with it, which I have not. Do you have any suggestions?
MS is complicated because it's actually it's episodic. So when it starts to affect the eye, so basically optic neuritis is the nerve has swollen and then it becomes unswollen. So it can affect, so if the nerve starts to get damaged, that's where some of the blurry vision can get to, because it's not relaying all the information to the brain at that particular time. The muscles are involved with that double vision is because your cranial nerves that help control the eye movements start to get damaged with multiple sclerosis, just because of their connections to the overall brainstem and stuff like that. A lot of times we can treat patients with overcorrecting one eye, undercorrecting the other eye, so that the eyes aren't working in tandem anymore. We can sometimes use prism to help with people with the double vision, to help so we can help their eyes fuse a little bit better. We can also put different filters in that make the eyes feel more comfortable, more than the filters that we've already talked about. That sometimes people adapt to like a green filter or more of a red filter and stuff like that. But MS is one of those diseases that we constantly chasing to make the eyes more comfortable and better. And when you do have MS, there's a lot of medications that are out there, the infusions, the injections, and the newer class of drugs are the oral ones that can cause some of the vision to actually be blurry as well. So we have to look for that. Beyond, is it the optic neuritis that's causing the vision to be blurry because the eye's inflamed, which is a very painful process, or is secondary coming from some of the medications that people are taking, the injections, the infusions, or it's the oral medications?
Is there any connection with extra virgin olive oil and neurological or eye health?
No, nothing I've read. I mean, there's probably stuff out there that I've probably have missed reading, but I haven't heard that really at all. No.
Okay. All right. That's good. Could LASIK lead to dry eyes?
Yes, it does. That's the number one complaint after when people have LASIK. And when you do have LASIK, you're on pretty thick artificial tears, gel Celluvisc after LASIK for anywhere post day one LASIK all the way from 3 to 6 months. If you have dry eye going in, or you ever had issues with your contacts, you definitely will have issues coming out of it. So we recommend people who want to do LASIK, we get them examined for dry eye, and we treat that with making sure that the eye's healthy so we can minimize the effect of dryness after you have LASIK surgery.
What's the benefits of LASIK surgery?
You get out of glasses and contacts. However, everyone's not a candidate for LASIK. So if you are an uncontrolled diabetic, they won't do LASIK on you. If you take certain antidepressants or anxiety medicines, and how many that you take, they won't do LASIK on you. If your prescription's really high, if you're farsighted and your prescription's high, they won't do LASIK. If you're nearsighted and your prescription's high, there's a limit that can be done with that. Age is another factor for LASIK surgery. And if you need reading glasses, unfortunately, LASIK won't cure not needing reading glasses either. You'll still need them after you have LASIK surgery.
Interesting.
So what
see afar?
Or what does it cure?
What LASIK? It will treat farsightedness and nearsightedness and people who have astigmatism within a certain limit.
Okay.
Is it a forever permanent?
No, it is not. Like, there are some people that can go 10 or 12 years and not have to have what we call a retouch, but then there's other people that can make it a couple years. And it all depends on your cornea, that first layer that I was talking about, how thin or how thick that is, will also determine if you will be able to be a candidate for LASIK surgery or not.
Interesting.
So if you have any type of like cornea diseases, that was that first layer that I was talking about. If you ever had a corneal scar, if your cornea didn't fully develop, you would not be a candidate for LASIK.
Gotcha. But if you are a candidate, it can.
Oh, I love it.
Do you see more younger people or older people getting it? What is the best age range for it?
I would say if you were going to do LASIK, I would do it starting in your mid-20s. Not to say that older people don't get it done, because I do see a lot of people coming through the surgical center that do have LASIK, but to get the best results, I would say I would get it in your mid-20s, early 30s. So it would last the longest for you. And because everyone essentially ends up needing reading glasses after the age of 40 something, you'd get the most longevity out of it for being able to see far away and up close without anything.
So for someone buying reading glasses, how do you know the right strength to get?
It's simple. It depends on your working distance. So if you hold things further away from you, the number needs to be lower. If you're going to be holding things closer to your face, the number should be higher. So so it's a by trial and error when you pick out those reading glasses.
Yeah, I find sometimes with my reading glasses that when I'm reading something in a book or in a notebook, I need my glasses. But then when I look to the computer, it's different.
Yes, because the working distance is different. So it's all about knowing the optics behind the length of what you're going to be working with. So something like your dashboard, a computer is more like arm's length away. So most people wear like a plus 150 or plus 175. Those people who do quilting or sewing that hold things closer to their faces, they would need a higher number. Granted, that would be for someone who already doesn't have a prescription.
Right.
And so sometimes if you have a prescription to see far away, that can change how we use the reading glasses and then the numbers. So I was just basically giving like a generalization of how to choose the reading glasses.
Yeah. So what is the best type of lens to get in your glasses, or does it make a difference?
Oh, it does. On children, we really like polycarbonate lenses. Polycarbonate lenses are more durable. They're less shatterproof. I've seen some tragic lenses come, like tragic frames, but the lenses are perfect when they come through. As you get older, I do like polycarbonate for adults, but depending on your prescription, how thick or how thin you want your lenses there's different types that can make it better for an actual prescription and stuff like that.
Good.
So for now that we're in the day and age of wearing masks everywhere we go, do you have any tips for people who wear glasses, how to get it to not fog up?
Yes. So I actually recommend like you just get a little bit of dial soap and some hot steamy water and really clean your glasses so like there's not a whole bunch of oils on there. When you do wear a mask, you want to make sure that you have a mask that has a bar on the top of it so you can press it like around your nose. If you wear a cloth mask, double-sided tape works out the best. Put some tape on your nose and then it will stick to your mask so it creates a seal so like you don't get the steaminess. And then also, if you feel like they're steaming, pull your mask away from your chin so it's still covering your mouth, your nose and your mouth, but it creates an airflow and then the glasses will not get steamy on you.
Wow, those are good tips. I never heard those.
Yeah.
That's
when
a
I wear
problem.
my glasses, it's so frustrating to like, I'm like holding the mask to make it not fog up.
So if that's happening, really you can put your finger underneath the lower half and it will create an airflow and then like that steaminess will go away. But I even when I wear my own cloth mask, you'll see me with double-sided tape on the back part of my mask and then the other side's to my skin, and then it creates a good barrier and it seals it right up, and then you don't have to deal with those issues like that.
Great.
Yeah. Sounds great.
Great tips.
So we have a question specifically for you.
Yes.
If it's not too personal, someone wants to ask why you decided to wear glasses, or why you decide to wear glasses versus having LASIK.
Oh, yeah, I don't qualify. My cornea is too thin for the actual procedure for my strength of my eyeglasses. So that references back to not everybody qualifies. I'm one of those people. So once they do LASIK on you, your cornea can be anywhere between 400 and let's say 600 microns thick. And so they take into account what your actual prescription is and then how much laser they would have to remove in microns to have you being able to see. And so if they remove too much, it could cause issues later on in life. And then some people, their cornea is naturally thick, so we have a lot more wiggle room to make that flap when you have LASIK and stuff like that. I unfortunately can't have the procedure done. I would, but I'm just not eligible for it.
Yeah, darn. So are eyeglass adjustments done at most optical stores? How often should you purchase new glasses?
You can purchase new glasses whenever you want. My husband said no more glasses because I have 2 baskets full. Before the age of COVID, I used to love to coordinate all my glasses to my outfits and stuff like that. But now with COVID, I'm wearing more scrubs. So I would buy new glasses all the time. My husband put a nixay on that. But people can buy eyeglasses whenever they want. They're a fashion accessory. So you just want to make sure that they fit your face well. You want to make sure that the glasses fit behind the ears. They're not too tight or anything like that. And then just have at it. There's never bad or a reason not to buy multiple pairs of glasses all the time.
So if you do have those multiple and your prescription changes, do you have to throw those out, or can you get them filled differently?
You can get them filled differently. I have a couple pairs that they're slightly different for different reasons. Like some of my glasses aren't as strong, so I don't wear them out. I just wear them like around the house and stuff like that. I typically say people, if you're going to have one really good pair and then one pair that you just wear for, like, if you're doing yard work, something that it can be a little tougher on, and then have a nicer pair that you wear out, or have multiple pairs. But if your prescription changes drastically, I would pick at least 2 to get started with to see if you like the change. But if there's slightly difference, not big changes, you can go back and forth, and then you will become aware of, oh, this one's a little bit clearer, this one's not, and stuff like that. And then pick and choose which one works out best for you.
Okay, that's great. So you're not throwing them out and having them buy
No.
So then are eyeglass adjustments, can you get that done anywhere, or do you have to take them back to where you got them from?
Most places will do it for you. Like if you're out somewhere and there's an optical place, most of the time they'll just have you sign a waiver saying that if they do break or anything like that, that they're not responsible for them. But most places will do the adjustments, no problem.
Hey, Dr. Bowen, go ahead and turn the light on behind you so that we can see you.
Is that too bright?
There we go. Nope, it's not at all. That's perfect.
Okay.
Yeah, thanks.
There you go. Sorry about that.
No, not at all.
Do you have any recommendations of places around Columbus that you could buy lenses or glasses for a cheaper price?
Every place is set up kind of differently. If you want good quality, you'll pay for quality. If you want to do something that is more custom, you can try Violet Eyewear. You can come to Divine and see us. But a lot of places are, it's really patient dependent. A lot of places have a wide variety of cost and stuff like that. But and I do hear a lot of people want to buy frames online and then bring them in to get the lenses put in them. You need to be careful about that because of the fact that not all frames are what we call RXable, meaning not all frames that you buy online can support your actual prescription. So those are some words that you want to make sure that you look out for if you decide to buy online and then have somebody else. I do have friends who buy from Warby Parker. I do have friends who buy from Zenni Optical. That's fine. But you have to remember you get what you pay for. And if the glasses are made wrong, then you will have to go through the expense of trying to figure out when to send them back and how to send them back and stuff like that.
Wow, that's a good advice, because a lot of people are definitely on Amazon, and there's so many, even when you're on Facebook, there's these big ads that pop up and they're 70% off, and you think you're getting a good deal, but they may not fit your prescription.
Right. And that's a big thing. You want to make sure that they fit your prescription and stuff like that.
Mm-hmm. Great.
Yeah, that's great. So, Carla, do we have any questions from Facebook, or do you have any
I don't think
questions?
so. I don't. Yeah, I think we're doing pretty good. I think maybe we should go ahead and wrap it up.
Wrap it up. Do you have anything else to add, Dr. Bowen?
I would love to see as many of you that I can. I do appreciate you guys having me on here. And if anybody has like any questions, they can message me on Facebook. I'm not savvy. I don't have Twitter. I don't have Instagram. So you won't see me on there at all. But if you ever see me, if you ever have any questions or concerns or anything like that, I would love to answer anybody's questions or anything like that. Have a conversation on what's the best and what not to do. I do want to remind people that eye health is very essential to overall body health, and that when you do come see us, just be honest with us, especially about medications, about how you're feeling about the eyes, so we can make sure that we're addressing everything. And sometimes we can't address everything in your initial exam, but we might bring you back to be more specific and stuff like that. And that remember to get your children checked. Because they don't know what clear vision is, they don't know what blurry vision is. And so if we want to get them started right away with good eye health, and if they have to wear glasses, it's not the end of the world. It's just to make sure that their eyes are working efficiently as possible.
Wow, that's a really good point. Yeah.
All right. Well, thank you again so much
You're
for all the
welcome.
knowledge. This was super helpful. Again, if anyone has any more questions, like she said, you could send her a message or send one to our page. I want to thank Carla for being on here, Mike for being behind the scenes, and I hope you guys all join us again next week at 5 p.m. for another episode of Wellness Wednesday. Have a great night and stay safe.
Thanks, everyone. Bye.